And how is this evaluation actually done? It's like a physical measurement. What is it? Blood test?
So the way the test is done is we needed something that was available to everyone and also affordable to everyone. And genetic tests back in 2000 were about $10,000 to $50,000 a hit. And so it wasn't feasible to expect that everyone would get gene testing. And we know that gene testing is only a predictor or a risk predictor. It's not actually this is happening in the body. We needed to understand what is happening in the body, and we needed to make it scalable. And so the way that you do that is by getting proxies for gene markers and gene expression markers, which are things like the size of your skull, the length of your jaw, the thickness of your neck, the thickness of your wrists. Now, not only are they related to different genes, but they're also related to different hormonal levels, and they're also related to different diseases. A thick neck is related to a higher risk of diabetes and heart disease and fatty liver. A thick wrist and a thick neck is more related to hypertension. We know that certain waist circumference are associated with various diseases as well. So the way the measurements work is we get a very good understanding of the size and shape of your body and how it has developed through 18 different measures around your body. We then have a 68-item questionnaire that goes through things like hair color, eye color, skin tone, your family history of disease, your personal history of disease, where you live, where you grew up. Some very important factors there that help us define the rest of you. And so all of that information clusters together. There's 10,000 different correlations that are used to inform the end result. And with all of that information, we're able to understand what's the general gene expression of your body over an extended period of time. Your bones didn't develop in a day. They developed over years of influence. And so by understanding the outside of the body, we get to understand what's happening on the inside of the body. As far as the error rate's concerned, that will depend on the individual measurer, but we did a lot of testing initially on if we send this out to someone to measure themselves versus we measure them, what's the error rate that we see? And so there was a lot of work done so that it can be accurate. And so it's always best when you're measuring to get someone else to help measure you so that you can remove parallax error and make sure the tape is tight where it needs to be. However, it can be done by yourself very, very successfully as well. And if you've ever got any questions about your results, you just need to send some photos off to the support team and they can confirm with you. They can do some additional measurements based on those photos and can confirm everything for you. So irrespective, you don't need to send any bloods or saliva off. We actually get all of the data we need from your phenotype, which is your gene expression, which is where we've spent an incredible amount of time scouring the research and doing our own research to make sure what we're measuring is what we are then interpreting. And so that's where the success of this model has been.